Welcome to my podcast. Today I'm going to talk about an examination for the abdomen. So I was doing a volunteer for the OSCE examiner for third year and fourth year and fifth year medical student. And I noticed certain things between each of them. So basically, I'm going to talk about this in brief, just how to approach this case. And it's also one of the cases in Blood 2 examination for the international medical doctor graduate. So basically, you will introduce yourself as we all agreed, double check the patient name and date of birth. It's preferably sometimes to introduce yourself with the full name, so it's basically the initial and the surname because sometimes there's common names like the initial, so this won't differentiate between whom and other person. So better to introduce yourself with the full name. And then basically you will tell the patient if he's expecting what sort of examination will be performed, and you will brief the patient what this will involve, and if there is any concern or any questions that the patient might want to explore more. And then you will wash your hand by the technique that we know, so you need to follow all of that. And then you will approach the patient and ask the patient sit comfortably on the edge of the bed and start over basically with the hand. So you will ask the patient, if you don't mind, I would like to have a look, close look at your hand. So I'm gonna examine palm and the dorsal aspect of the hand. So you look for palmar erythema, dubitrin contracture. Any nodule, anything doesn't seem right. Also, if there's any scars, for instance. And then you will check for the nails, for any discoloration, for any changes in the nail, like cheliconiacia, like clapping, also whereby there is augmentation in the angle. And you will ask the patient to put two indexes close to each other, look for the angle for this one clapping, and also examine if there is any other changes in the nail, like splinter hemorrhage, leukonychia, pitting. And then you'll ask the patient to extend the hand in front of him and look for any tremor, and then ask the patient to dorsiflex the hand and look for flabbing, which could indicate hepatoencephalopathy or uremia. And then you will ask the patient that you will kindly examine his face. So you're gonna look for the eyes for anemia, jaundice, any changes around the eye, like cholesterol deposition, xanthelasma, and any other changes like sort of complexion, darkening of the eye. If there is exophthalmos, so you'll see the rim over the lid will be basically retracted, so the rim over the iris will be visible. And then you will ask the patient, you need to check his mouth, so you'll ask the patient to open the mouth, look for any changes like angular stomatitis, glossitis, ulceration, any ill-fit, maybe there is denture or any thing that looks not normal in the mouth, and also if there is any missing teeth or if there is any gum issue, and ask the patient to stick the tongue in the palate and look underneath basically the tongue, and also don't forget about cyanosis if there is heart issue. And then we will ask the patient to lie down comfortably in the bed and ask him to expose the area from the waist up, and tell them what you're gonna do in order for the patient to be prepared. So, and before putting your hand or doing any of that, you need to ask if the patient is in pain in order to start away from the pain. There is another thing that I notice. We know that it's always inspection, palpation, percussion, and auscultation. So this is the order of the examination. I know some of the students were mixing between this and that, and they aren't in order, and they just are random. So we need to stick to this in order to follow systematically examining. So basically, you will ask the patient that you're gonna put your hand and feel lightly, which is called light palpation. So basically, on the nine quadrant of the abdomen that we all know, and then you will tell the patient, I will do deep more. I mean, not light; it's a little bit more harder, in order to look for any tenderness, any mass, and look for the patient expression, of course, and always double check if the patient is comfortable or not. So you'll do it systematically. So, for instance, you start from the right iliac fossa. You will go, vertically, and then horizontally, and then vertically again, and then horizontally, and then pass through the middle area. So this will be like a systematically approach. And then you will start from the right iliac fossa and work your way up to the edge of the costal right side in order to check for any hepatomegaly. So I'll ask the patient breathe in and out, and while the patient doing so, you are putting your palm with the edge of your right index and just palpating until you reach to the right costal margin. And then from the right iliac fossa, you will work your way the same way to the side of the left costal region, whereby I'm going to check if there is any spleen enlargement. And then when you do this, you will follow it with the kidney examination. I know some of the students, they forget about the kidney totally. So you need to check for the kidney as well, if there is any tendons, any mass, any pollutant of the kidney. So you need to put one hand in the flank and the other hand from the front and just feel for the kidney. And once you did this, you will ask the patient if he has full bladder, for instance, because when you did the palpation of the general abdomen, you will feel in the suprapubic area if there's any discomfort or just tenderness. You'll ask the patient if he needs to go to the loo to empty his bladder. After doing this, you will percuss basically. So if there is any, like for instance, if the patient has, when you did the general inspection, if there is any, for instance, swelling, any mass, usually swelling, if it's distended abdomen, all over, so it could point out to ascites. So you will firstly auscultate, you will firstly percuss to see to differentiate between the normal tympanic percussion with the dullness if it's not on the organ. So basically, you will work your way down from the right iliac fossa to the right costal margin just to feel if there is any dullness in that area, which could denote a slight or liver enlargement. Same way to the spleen. And then over the colon, it's basically tympanic, and if it's hyper, it means that there is accentuation. And then if there is any, for instance, fluid in the tummy, the abdomen, you will check for shifting dullness. And then after this, you will auscultate. So you will ask the patient that you are now going to auscultate. So you need to clean your stethoscope and put the bell and the diaphragm region. I saw some students were doing between diaphragm and the bell region, which shouldn't be an issue. And here for the bowel sound for 1 complete minute at least, just to see if it's normal or exaggerated, or if there is no sound at all, which could indicate obstruction. So after that, you will conclude with the patient that you did your abdominal examination. However, You need not to forget about checking the lymph node, because sometimes you just need to mention that. I mean, according to the task, of course, because you need to stick to the task. So you'll check for the neck, for lymph node. Basically, we know that there's different groups of lymph node in that area. So you start with submental, submandibular, and then the cervical, anterior and posterior, and supraclavicular, which each of one denotes something. So, like the left side could denote gastric carcinoma, and the right usually in lung cancer. And then you will also examine for hernial orifices. So you ask the patient to cough and see if there is anything protruded from the orifice area. And then you will tell the patient if there is a need. Of course, you will examine the genitalia and then conclude with the BR, which is digital rectal examination. Of course, all of that you will tell that you would like to have a chaperone with you to preserve the patient. Dignity. You need to cover as well, and each of any of those maneuvers, you need to give like a warning or just tell the patient in order for the patient to expect what's going on in regard. So by that, I hope that I covered examining abdomen in a systematic way. And then you need to, of course, conclude your finding to the examiner by starting off. I'm going to present my patient, his name or her name, the age, and then you will just hint systematically if there's any finding. Or you will say, for instance, if it was normal abdomen examination, you will say, for my examination, I couldn't feel any mass or any enlargement, and the abdomen was soft and lax, and no tenderness, and percussion, it's normal tympanic percussion, auscultation, normal bowel sound, which all conclude normal abdominal examination. Thank you.